Hello everyone, let's discuss epistaxis. Nosebleed or nasal bleeding is also known as epistaxis. It occurs when blood vessels in the nose break, leading to bleeding. The nose has a rich network of delicate blood vessels close to its surface, making them prone to injury. There are many causes that can lead to injury. Dry air, which can irritate and crack the nasal lining. Nose picking, trauma or injury to the nose. There are also certain medications like blood thinners which can lead to injury. Nasal bleeding is of two types depending upon the area involved. If bleeding occurs in the front of nose, which is most common but less severe, it is known as anterior nasal bleed. But if bleeding occurs deeper in the nose, which is less common but can be more serious and sometimes may require medical attention, it is known as posterior nasal bleed. Common symptoms of nosebleed include blood flowing from one or both nostrils. This can be a clear and visible sign of bleeding. It is also one of the hallmark signs of nasal bleed. Then comes the blurry drainage down the back of the throat. This can lead to spitting or vomiting of blood, especially in posterior nosebleed. If the blood loss is significant, dizziness, lightheadedness, or weakness can be observed. Then comes the treatment. The treatment for a nosebleed generally focuses on stopping the bleeding and preventing it from reoccurring. For anterior nosebleed, which is the most common type, first aid needs to be followed. We follow trotter method in this, which includes sitting upright and leaning forward. This prevents blood from draining down the throat, which can cause nausea or vomiting. Then we need to pinch the nose. For this, we need to use thumb and index finger to firmly pinch the soft part of the nose, just below the bony bridge. Hold the pressure continuously for 10 to 15 minutes. Do not release the pressure to check if the bleeding has stopped before 10-15 minutes has passed. Then apply a cold compress. Placing a cold compress or ice pack on the bridge of the nose can help constrict blood vessels and reduce bleeding. We need to remain calm throughout, as anxiety can raise blood pressure, which can worsen the bleeding. Now let's talk about management for posterior nasal bleed or severe anterior nasal bleed. The primary goal is to apply direct pressure to the bleeding vessels, which is difficult to do manually. Thus, nasal packing is required. Nasal packing involves inserting a material into the nose to create that pressure. Often, posterior nasal bleed require specialized packing that is inserted by doctor himself. Another option that we have is cauterization. This involves using chemical, heat, or electric current to seal the bleeding blood vessels. This needs to be done under the supervision of healthcare professionals. Also, if the nasal bleed are caused by medical condition or medication, the treating doctor will address the issue. There are some medication that can also be used to treat the nasal bleeds. Then comes the home care and prevention. First, we need to moisturize the nasal passages. Use of saline nasal sprays or drops can help keep the nasal lining moist. A humidifier can also help prevent dry air from irritating the nose. We can also apply a small amount of petroleum jelly to the inside of the nose. Avoid nose picking, as it can damage the delicate blood vessels in the nose. Avoid blowing the nose forcefully. If there is any necessity to do so, do it gently. Stay hydrated. Now the question arises, when to seek immediate medical attention. There are some critical medical situations that demand immediate action. First, we need to control heavy bleeding. If the bleeding doesn't stop even after 20 minutes of firm pressure, it is an emergency. The individual needs to visit the nearest hospital. Then we can watch for various signs such as difficulty breathing, sudden dizziness,
or lightheadedness, this is also an emergency. A nosebleed following a head injury signals a serious warning. Also, if the individual experiences frequent nosebleed, this also needs to be addressed. Finally, if an individual swallows a large amount of blood or vomit, he or she needs to get help right away. So, nasal bleed are common and typically not serious. However, frequent or severe nasal bleed may require medical attention. Thus, we need to be very vigilant. So this was all about the video. Thanks for watching.